With a new president, of course, comes a new approach to COVID-19. The Biden administration has promised to make controlling the pandemic its #1 priority. Dr. Mallika Marshall joins us now to discuss. And Doctor, the first step is to relieve states of some of the burden. How will they go about that?
Yeah, it's because the former administration left a lot of the logistics up to states. And as we know, quite a few states have really floundered on their own, trying to outbid one another for supplies and equipment, trying to secure vaccine doses, trying to trace the virus on their own. But the Biden team is hoping to broaden the influence of the federal government and their oversight, providing more funding and more guidance to states to help them out.
Yeah. And another big noticeable change will be a mask mandate.
That's right. So President Biden says that he's going to ask everyone to wear a mask, at least for the first 100 days. And he's going to mandate it for federal workers inside federal buildings and for people traveling between states. So if you're on a train or a bus going between states, you're expected to wear a mask. You'll also see a real public awareness campaign to try to get people to wear masks, which is a stark contrast to the former administration.
And what about testing?
Ramping it up. They really want to ramp up testing. They want to make it more available. They want to make it more affordable. They want to expand contact tracing to try to limit the spread of the virus as much as possible. They want to increase surveillance so that we can also try to find some of those new genetic variants. And they're expected to use the Defense Production Act to increase supplies for healthcare workers, testing supplies, vaccination supplies like syringes and needles. So we should expect to see a lot of stuff increased over the next few months.
President Biden has said he wants 100 million vaccinations given in his first 100 days. Is that realistic? Is that even possible?
Experts say it is, but given the fact that there have been 30 million doses that have been distributed, but only about a third of them have gotten into people's arms, it's going to take a lot of work. So the new administration wants to encourage states to expand their priority groups to include people 65 and older, other frontline workers like grocery workers and people who work in transit. They want to build 100 mass vaccination centers in places like stadiums, like Gillette, for example. They want to establish thousands of mobile and community vaccination clinics and deploy about 100,000 healthcare workers to help staff them. They also say they'll use the military if they need to, and they want to use commercial and neighborhood pharmacies to try to get that vaccine out.
Right. Now, all of this is going to take a lot of money. Is the president, he's going to have to turn to Congress for this, right?
He is, because it's actually a really ambitious economic stimulus plan as well. So one thing he wants to include is to give more paid sick leave for workers who have to quarantine or who might get sick from the virus. But of course, it's going to take money. And who does he have to ask for that? He has to ask Congress. So we'll have to see what happens.
All right. Dr. Mallika Marshall, thanks so much.